Thank you, Mr. Chair. Good afternoon, everybody. Madam Chair, thank you. It's a pleasure. Look forward to working with colleagues from both chambers and from both sides of the aisle. I think we have consensus and near consensus on some very, very positive steps. I just want to highlight a few on the side of the Committee on Alcoholism and Substance Abuse. In the governor's executive budget, he proposed shifting concurrent review for substance use disorder from 14 to 21 days, and we in the Senate passed in our one house moving that to 28 days at the request of patient advocates. You know, time is the enemy in these cases, and the minimum goal has always been 28 days, so let's not step it, let's go right to the 28. So we're very positive about that. We do appreciate in the executive budget that the number of co-pays for outpatient treatment and aftercare will be reduced down to a single copay, and that would be no more than a primary doctor's office visit. We've been told by patient advocacy groups how expensive that is when they see 2 and 3 specialists a time when they go for an outpatient visit. So this will go a long way to help easing the cost burden on patients and their families. We also, in listening to some of the treatment providers who've been having difficulty recruiting qualified counselors and social workers to certain parts of the state, we put in $750,000 to begin a pilot program whereby folks can use the incentive to help pay off student loans if someone agrees to come work in an OASIS-approved treatment center and in a part of the state that's been identified as having a shortage of qualified counselors. So that is another positive step. I'm thrilled to hear my colleagues in the Assembly discuss supportive housing. That's something I've long been in favor of more of. We know it works. I really am excited to work with colleagues from the Assembly on that. The Dwyer Peer-to-Peer is a critical program. I'm glad that we're opting to expand that to other counties. That's how successful it is. And finally, I just want to say that from our side, even though it's not discussed at this table, it's at the revenue finance table, we did agree to the opioid tax. One, because it's already a $100 million hole from the last budget, but we want to use that money incrementally in the war on opioids. That's what we want to use that money for. We don't want to just wash it and sweep it into the general fund. We want that to be an incremental funding source for the war on opioids and fentanyl. So thank you, Mr. Chair, and again, look forward to working with everybody here.